Huples cat and Mr. Bear. I have flu. Which online prepping has reliably informed me you will get by watching this video, especially because I haven't groomed my hair, because I haven't been to the barbers, because there's a pandemic in the community. And that's one of the things I want to talk to you about today. I'm going to put up the entirety of an advert from the World Health Organization. You can go online, and for very little information you can enroll in the course for free.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus.
You can actually create an email account and not be known to them, but IP addresses, etc. It's important that we understand information. And what has happened in COVID-19, in my opinion, is an absolute failure of prepping. An absolute failure. There are so many people online putting out absolute bilge and garbage and conspiracy theories rather than dealing with the issue. And one of the ways of dealing with the issue is to get reliable and sensible information. Right there? Because what you don't want to do is spend your time and efforts watching endless live stream by people who have the academic ability of a gnat and have made no actual preparations, going on and on and on about welding people in buildings and martial law and taking your guns off you. This is the time to act. Now I'm going to give you a story, because I like stories. Narratives are very important. Bear with me. There's an aeroplane. The aeroplane's called Africa. And there's people on the aeroplane and they wander around. And over time, they jump out of the plane, land on the ground and build their own planes and take off. So eventually you have about 200 aeroplanes flying around in the sky. And then we have international trade, and there's lots of trade between the aeroplanes. Now all of the aeroplanes, essentially 99.9% of their manufacturer and 99.9% of the people on board and the creatures on board those planes are genetically identical. So one plane called China has a pandemic. It wreaks absolute havoc. It spreads, it causes absolute terror and destruction. What happens to the plane marked America and the plane marked Canada and the plane marked United Kingdom? The people on that plane mostly are not preppers. So they do what they're told to do. They keep shopping, they keep travel, they are a little bit on guard, they're watching it. And the message they get is, this is new, this is novel, and we're evolving, but we have great public services in place. We can barrier ourselves from this, even though the plane called China was completely unable to do so. And that's a bit of a clue. China is not the China of the 1980s. China is in 2020, is almost the world's superpower, and is going to be the world's superpower, probably. And it's not something that people on the plane marked United States or Canada can look at and go, yeah, nothing to do with me. And yet that's an actual attitude that a lot of preppers have. And even worse, they then fill themselves full of misinformation. They're making N95 masks out of fiberglass. And fiberglass, when you cut it and inhale it, causes lung cancer. This has been known for like decades, right? They're doing crazy, crazy things. The truth of it is that right now, if you're watching anybody online who has a beard, stop it, unsubscribe them, they're an idiot. There is a pandemic, it is droplet, possibly airborne. You need to be able to put an N95 mask on at any time you're in the public, any time in the public, to pretend, to think that this disease is not in your community, absolutely flies in the face of everything human science has ever learned about droplet, flu, viral infections. It's nonsense. It's everywhere. It's all around us. If you wait to put the mask on in case you see somebody like me who's got a discharging nose and a very sore throat, and yeah, I actually took flu care meds, which I never take, it's too late. Yesterday, the day before, and maybe 14 days, maybe 21 days before, when you were with me and you used the gasoline pump or you were in the lineup at Tim Hortons with me, I infected you and you still don't have symptoms and you're wandering around infecting your family and friends. Basic flu spread is very, very hard to deal with. We have no magic bullets. There's a lot of nonsense being said online that we can just take tons of Tamiflu in mega amounts, which really concerns me. I certainly wouldn't do that unless I literally was about to die. With HIV meds, also in mega amounts, seems to have some effect on this. It probably does, but what's the long-term effects of this? In SARS in 2003, a lot of my co-workers had SARS in Toronto, and people I know, friends, people I got drinking with, and they actually were filled full of high volume steroids, which they're not doing this time, but at the time the doctors thought this would help, and it didn't help. It gave them a lot of muscle weakness for the rest of their lives and did absolutely nothing to slow the progression of SARS. I was going to name and shame, I'm not going to. There's lots of people who put out COVID-19 videos, and I encourage them to do that. I encourage them to speak out, talking about what they're doing, how they're dealing with it. What people are putting out is conspiracy theory. It's where did this come from and all the rest of it, and what's going to happen when it gets here, and what's the government's behind it and stuff like that. No, what we need to be doing is understanding that the plane marked China is crashing into the ground, and it will bounce back up again. It's a temporary shtf, and we're all on our planes marked America and Canada and Britain, and we're all looking at the Chinese plane about to smack into the ground and go, yeah, it won't happen here, so I won't bother prepping for it. I'll just ramble on about how Bill Gates patented the virus, which he didn't. I'll ramble on about it being a bioweapon, which it isn't. I'll ramble on about this being the New World Order to get rid of cash and make us all a cashless society, which it isn't. I'll talk about videos I've seen online from Twitter that show me categorically that they're stacking the bodies in the streets of Wuhan and burning people alive, and they're welding people alive in their own buildings. All of that stuff is absolute garbage. Anybody with the IQ above 2 would realize that. All of these things have logical, reasonable explanations. The videos you're seeing are being quoted and copied out of context. This is like the bat video. There is no actual evidence that most people in Wuhan City eat bats whole that haven't been skinned. Think about it. You're going to eat a bat soup, and there's the bat. Hasn't even been skinned. Bats have fur on them. What is the intellectual level of people who look at videos like that and believe it? What is going on here? This is the time to prep hard. We're at the beginning of a probable global temporary pandemic, and all I'm seeing for most people online is bilge. It's garbage. It's conspiracy theory. It's doing anything but actively restraining their lifestyle. They're still going to work, they're still taking the kids to school, they're still going to the gym. I mean, you're going to the gym with a full set of beard, one of these guys who's got a huge bunch of subs from this. Most of his live streams, they talk about absolute rubbish, including the fact that chemtrails are spreading the virus possibly, and all this stuff. These people have no ability to deal with this. This is the same thing that happened in Jade Helm in 2016. A few people look at a few bits of information, they add 2 and 2 and they're making 5. This is not the time to give a damn about where this virus came from or which animal set this virus off. You're not a virologist, you're not going to make the vaccine. What this is the time to do is to monitor this very closely from reliable sources, to spend most of your time getting your preps that you should have in place tightened up, to anticipate a 3 to 6 month period of zero economic activity. Zero. Shut down. The interstates will be shut, the trains will be shut, the airports will be shut, most people's jobs in the service sector will be shut, most people's jobs in the manufacturing sector will be shut. We're already seeing this, and when I do my stupid prepper video, I'm going to actually show some people saying stupid things, and I'm also going to show some sites, some prepper sites that are saying smart things. We're going to run out of medications, we're going to run out of face masks, we're going to run out of basic foodstuffs. The world is completely integrated. This is what end stage capitalism has given us. There is no Chinese market and an American market. There is a global market, and it's dominated by a handful of companies and a handful of billionaires, and they are going to emerge from this in great condition. And they don't really care too much about a temporary SHTF. knowing that it will reverse. Because this will reverse. This is not nuclear war. We haven't got 5 years of nuclear winter to get through. In about 3 to 6 months, things will be fine. The stock market will rebound. Right now the stock market is being kept high because the governments, who have very little power over their economies, are desperately inflating their economies, desperately trying to avoid a stock market drop because, let's face it, taxes and tariffs have been slashed all across the world for decades now with one purpose in mind: to increase the volume of world trade. And that's a great thing if you happen to own world trade, because then you're absolutely making so much money. It's farcical how much money people have at the top, and increasingly the middle and the lower and the upper middle class are paying less and less and less actually for their labor. And we're raced to the bottom. We're already at the bottom in the United States. The amount of money people earn over there for various jobs compared to what they're still earning in Canada is terrible, and it's a disgrace. But we are left with one thing only. We're going to be on our own, essentially, with our local communities for a 3 to 6 month period, as and when this pandemic goes Wuhan City all across the world. Most of the World Health Organization, most of the CDC, most of the virologists, most of the epidemiologists are clearly saying this is not just a possibility, it's probable. And most preppers online are saying it's no big deal, stock up a little bit, buy some guns and some ammo, because I'm sure you guys are short of that, right? And it'll be fine. You personally won't catch it. It's already in the urban centres. It's already in the rural areas where people from the urban centres have gone. It takes 2 to 3 to 4 weeks for this thing to start to develop a base in the community. And then it takes another 3 to 4 weeks before it starts to give significant cases. Pretty much most of the nursing staff I know at my hospital have had a bad flu season. And that's fine of itself. The concerning thing, this is the concerning thing, is infected, isolated viral respiratory symptom patients admitted to my hospital are at an all-time low. The flu that's out there isn't driving people at the moment to seek medical care, which, if you follow anything at all on COVID-19 from any of the official sources, is a little indication that this could well be not just regular flu, but it could be COVID-19. And we now have a death rate that's rising from it. It's currently 2.67% of all cases die from it in China, which is where the majority of cases that are known remain. This is extremely serious. This is the start of a global temporary pandemic, shtf. Are the sources you're looking at online, are they giving you straight information with opinion and interpretation, which is completely fine, or are they giving you opinion and interpretation as fact? Are they breathlessly pushing out live streams and videos every 5 seconds to warn you about what? This is the start of a global temporary pandemic. Da-da! That's all you need to know. All you need to know is you need to be tightening up your preps, getting ready for quarantine in the house, doing all of that stuff. I will do an improvised PPE video. I really don't think I'm going to do it today. I'm febrile and I have an upper respiratory infection, so I don't really want to put on the PPE today. I'm going to take it easy today. If I don't feel well tomorrow, I won't put out a video. I'll just put out the part 2, the repeat video of the first aid thing. But I do intend to put out a stupid pandemic prepper video, because I think it's important people are actually opening their eyes and their minds as preppers, because you're the people around you, the community, are going to want to talk to as this develops. I know right now in North America there's this huge reluctance to even discuss this as a potential amongst preppers, let alone other people. But I know from people that have just come back from England that the English population is starting to get really worried. And that's going to happen. We're going to see increased caseloads, we all know that. How far this will go, nobody quite knows. How bad this will be, nobody quite knows. But to be thinking this is a Chinese disease is wrong. China is not the sick man of Asia. That's a racist term, by the way. But what are you personally doing right now? So the first thing I would suggest you do is watch that trailer that I'm going to put up now. It's only 5 minutes, it's instructive, it's interesting, it gives you some detailed background on what's known a few days ago about this disease. I would also suggest you strongly consider enrolling in the course and doing it. Information is power. It's a good idea. It's a good idea to do a Google search and look for nursing care of isolation patients. Don't watch prepper videos on how to isolate people. I happen to be a registered nurse. I happen to be a nursing teacher at university. I happen to be a hospital administrator. So I think I'm a reasonable source for stuff on how to actually deal with this. But if you go to actual hospital and nursing care sites right now to learn about how to wear a mask, how to wear a gown, how to give somebody a bath in bed, all of those things are really, really important, and you're not getting them from the prepper sites. What you're getting from the prepper sites is a real mixed bag of farcical eco-terror doomish, or it's fine, don't worry about it, we're cool. But the truth of it is, the supply chain is integrated globally. It's taking a hit right now. We're running out of medicine and medical supplies today. We're going to run out of consumer goods. We're going to run out of a lot of things. We're going to not die en masse, but there's going to be extremely limited ability to buy stuff, even if you feel happy to go out and buy it. If you haven't done so today, watch some of my videos, look at the clues. Unlike Uncle Al, I'll tell you, get swim goggles. Get 4 or 5 pairs of swim goggles that fit all of your family. Make sure you have N95 masks in place. You don't need a huge amount because you're not going to be going out much. You need to make sure that you can cook at home for a 3 to 4 month period. You need to make sure that you can eat cold food at home just in case you can't cook. You want to make sure that you can have a fairly variety of vegetables and fruits in tins and packets, dried fruit. You want to make sure you have plenty of nuts on board, like 2 or 3 pounds, maybe 10 pounds of nuts. You want to make sure that you have shredded wheat. You want to make sure that you have milk in UHT containers, preferably a nut milk, preferably a soya milk. Vegan's the way to go. Eating meat's probably caused this disease, but people won't accept that because it's a Chinese meat that they eat, whereas we're concentrating pigs, cattle, cows, and chickens and ducks all across North America. We don't think we'll cause something like this here, but we will, given enough time.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, nCoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water, or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
So that's it from me and Mr. Bear. I hope you enjoyed this video. Please feel free to respond below. Yeah, for those people out there that won't watch my videos because I don't groom and I don't have a slick impression online, get stuffed. If you're that shallow, I don't care. I'm not here to have a 1 million person channel and have Patreon and subs and make tons of money. I don't care. If you're that shallow and naive, take a hike. This is a Bad Terry production 2019.